We're going to focus on a couple things today as highlights. First of all, to talk about sort of the state of healthcare, primarily hospitals and what's happening in hospitals across the state, especially right here in Sylacauga at CVMC. Then we're going to talk about the Medicaid program in the state. And one of the things that I will say to you, I'll submit to you today, that I believe in the state of Alabama and really many states across the country, there are some misconceptions about the Medicaid program that hopefully we can begin to answer some questions today that give you a better understanding of exactly who is Medicaid in the state of Alabama and what are the benefits that Medicaid provides in the state. Secondly, we'll talk about a proposed solution that, again, I will submit to you would be very, very important for Alabama hospitals, not only as a lifeline for big hospitals in big cities in Alabama, but also mid-sized hospitals, small hospitals throughout the state. So let's dive in. What does healthcare mean in the state of Alabama? As you can see up top, Alabama hospitals employ nearly 90,000 people in the state of Alabama today. They support an additional 96,000 jobs outside of Alabama. If you're involved in any way in economic development, you recognize that a job creates a job. So about 90,000 direct jobs, about 96,000 indirect jobs. Healthcare in Alabama has a $20 billion a year economic impact. It's a big part of the state's infrastructure. Well, let's bring that picture to home here in Sylacauga. CVMC directly employs 650 people today, generates labor income of about $44.4 million a year, has an annual total economic impact of about $130 million a year, and indirectly adds about 1,250 additional jobs to the state. Obviously a very, very important part of the infrastructure in South Talladega County and across the county. Hospitals are critical to our state's economic structure. When you think about businesses coming into communities, businesses, decision makers ask about school systems. Dr. Seeger, we appreciate your leadership and you being here with us today. They ask about churches. They ask about safety. We appreciate the public safety in our community. And they ask about health care. Obviously, hospitals being in communities are vitally important to continued economic growth. One of the challenges that we face today in Alabama is the continuing economic pressures and a downward spiral effect in terms of how we get paid. Let's talk about Medicare for a moment. I said we're going to talk about Medicaid primarily. Let's talk about Medicare for a moment. Many of you in the room today with us are Medicare recipients. And you may or may not know this, but the way we get paid from Medicare in the state of Alabama compared to the way every other state in the union gets paid is different. And I'll try to bring that to life for you in a way that you can understand. In many cases, our cost structure is the same. We pay employees, we pay physicians, we pay for supplies, knee replacements, and hip replacements, and all those things that you may come into the hospital for. The cost of those, in many cases, is even higher in a place like this because we don't have the purchasing structure and benefits that many other larger hospitals have. However, when we bill Medicare, let's say that we bill Medicare $1. And you think about hopping on a plane today, going to New York State or to California or to Connecticut, and those hospitals bill Medicare $1, they get paid $1.40, $1.45 on the dollar when they bill Medicare. If you come into CVMC today and we drop a bill within the next few days to Medicare, Medicare pays us 68 cents on the dollar. That seems a little unfair, doesn't it? And it's a real challenge for us in the state to be able to manage with that sort of cost structure. And unfortunately, it grows a little bit more challenging every year because the way the government has that set up, it doesn't change. No new dollars come. If money gets higher for the higher folks on the scale, it comes out of the skin of those of us on the lower end of the scale. So obviously, reimbursement is a huge challenge. Last year, as you'll see here, CVMC provided $18.8 million in uncompensated care. Today, if we have 100 people walk into the emergency department at CVMC, 28 of those people that walk in will have zero ability to pay. And as our providers in the emergency department will tell you, we don't ask about your ability to pay when you arrive. We ask what your chief complaint is, We do a medical screening exam, we commit to help you get well, and then we talk about those challenges. And today, 28 people who walk into the emergency department will contribute to this $18.8 million that we provided in uncompensated care last year. Let's talk about the impact of those reimbursement challenges. 6 of Alabama's rural hospitals have closed since 2011. The median operating margin for rural hospitals is negative 12.2%. For those of you who have been in business, who have looked at income statements and balance sheets, who've been entrepreneurs, who manage organizations, you know that a median operating margin of negative 12.12% is not sustainable. And that's why you see some of these hospitals have closed. 88% of rural hospitals in the state of Alabama are operating in the red, meaning they're losing money on an annual basis. What does it mean when we blow that up statewide to include small, mid-size, large facilities? 12 hospitals in Alabama have closed since 2011, and 75% are operating in the red. One of the challenges that's contributing to the economic woes that many of the hospitals face today is the mental health challenges that we face in the state. A few years ago, Alabama made a decision to, for the most part, with a few exceptions, get out of the inpatient hospitalization needs of mental health patients in our state, which is very real, as illustrated here. As you see, Alabama ranks #1 in the nation in the number of opioid prescriptions written per capita. When you hear folks talk about the opioid dilemma across the country, and especially here in Alabama, you'll understand that. We have 7 Alabama congressional districts. All 7 of those are in the top 30 across the country for opioid prescriptions. Unfortunately, access to care for many of these people is in the emergency department of hospitals throughout the state. It's not the right place to provide care. It's expensive. There are pressures in terms of getting people in and out, as you certainly well know, and this has become an increasing challenge for our area hospitals. So what can we do? How many of you today believe that the glass is half full, in spite of what I've said? Yes? Let's consider the glass to be half full and identify opportunities for us to improve. How do we do that? Well, first of all, let's step back and talk about what I said just a moment ago, and that is, let's explain what Medicaid is. Let's help us understand exactly what Medicaid does for its recipients and providers in the state of Alabama. Medicaid is a type of health insurance for children, pregnant women, the elderly, and the disabled. Alabama Medicaid, unfortunately, has one of the most restrictive qualification guidelines in the country. And essentially, that's put together to keep people off the rolls because of the cost of Medicaid. To illustrate that, what you'll see is here. A family of 3 in the state of Alabama that earns $3,744 a year. That's their annual income. If you earn $3,745, you can't qualify for Medicaid. So getting on the Medicaid rolls creates a lot of challenges. It's a vital part of what we do. What I would tell you here, hospitals, doctors, pharmacists couldn't survive without the Medicaid program in the state of Alabama. And certainly we appreciate the leadership of our state keeping this program going. We have 2 children's hospitals in the state of Alabama, one in Birmingham, obviously a beautiful facility downtown, Children's of Alabama, and USA Women's and Children's in Mobile. And as you can see, 60 to 70% of the patients that they see in their facilities are covered by Medicaid. So it's obviously vitally important to the state. So who is Medicaid? I suspect that I'm about to introduce you to 2 elements of Medicaid that you really haven't thought about. Perhaps, again, to the misconception that many of us historically have had about Medicaid. Medicaid affects people in our community. Medicaid affects people in this room today. And I want to introduce you, first of all, to Jackson Thomas. You might see one face up here that's particularly recognizable to you, and that is Tracey Thomas, today the Executive Director of our library. I didn't have the opportunity to meet Jackson, and I feel like I got robbed a little bit. I have had the opportunity since to learn more about Jackson's story, and I want to thank especially Tracey for her courageous willingness to be a part of what we're doing today, to talk about Jackson's life and the impact Medicaid had. Tracey?
I want to start by saying that as a parent who has a child that will be 16 in just a few months and driving, Without me in the car, I'm especially thankful. It's comforting to me to know that we have Kiss Valley Medical Center in this community and all the ways that they serve so many people. And I don't say that jokingly. I'm one of those parents. I'm absolutely terrified of my child getting out to drive. So knowing that we have somewhere here in town that if something were to happen, somebody could treat him quickly, that is so comforting to me. So I just want to start off with that. Is that good? Okay. When Mr. Sisk asked me if I'd be willing to share my story, I thought about it and I thought, a few years ago, it would have been difficult to share the story because we were a little bit embarrassed about it, but we're not anymore. And so I wanted to just tell you a little bit about our family and who we were. And in 2007, my husband Greg and I found out that we were expecting our second child. And we were absolutely thrilled. We have the one child, Taylor, who's a sophomore at Silicotta High School now. And we were thrilled because we're planners. And so even before we got married, my husband wanted everything to be planned out just right. So we couldn't get married until we both had jobs that had good insurance. So we had to, we had to checklist. We had to check everything off. He wanted us to buy a piece of land to build our house on, and so we had to check that off. And then he wanted me to go back to school and finish my bachelor's degree. And then we couldn't have kids till I finished my master's degree. We had to check some more things off on the list. So we planned everything in life. And so, when we found out that we were expecting Jackson, our second child, we were thrilled because we had planned the timing on when we would have our kids, because y'all know that works real well. But when we finally found out we were expecting Jackson, I was 30 years old, Greg was 32 years old. We've been married for 9 years, so again, those were all things we planned out. We both had well-established jobs with good insurance, and I'd already been at my job long enough, I was vested in the retirement plan, so we felt like everything was, followed into place for us. So when I found out, I was 35 when we found out I was expecting Jackson. And we were excited because, again, we planned it. Taylor would be coming out of daycare, going into kindergarten, and we'd be putting another one in daycare so that it didn't cause a financial strain on our family to have two in daycare at one time. So everything was going according to our plan until November the 20th of 2007. And when I left here that day, I thought that when I went into labor, I thought I was leaving the Comer Library to go on a 6-week maternity leave, because I've been working here at the library with Dr. Spears for 15 years, and that's something else that I planned, 6-week maternity leave, come right back to work. So when Jackson was born that day around lunchtime, they immediately came in and told us that he had some issues. And within about 2 hours, they came in and they broke our hearts, and they told us that he was terminally ill, and we would be very lucky if we had him for 9 months. So, we sat and we talked, and after the initial, shock of the diagnosis sunk in, and the sadness that we were feeling, our minds settled on the fact that, hey, we're suddenly a one-income family. And we didn't come here today expecting that to happen so quickly. We thought I would come back to work. So we realized in just a few hours that this perfectly crafted plan we've been making all these years that we've been married had fallen apart pretty quickly. So as we approached the first full 24 hours in the hospital, my husband had gotten on the phone, and he had already sold his truck, he had already sold his Jeep, and he told me, he said, we're not going to be a burden on anybody. That's not, my family doesn't need help, we're going to be fine. And so my husband was really proud and didn't want help from anybody. But in order for me to stay at home and take care of Jackson, we would have to make some sacrifices. And our family was happy to make those sacrifices so that I could take care of him at home. He had a really compromised immune system, so a simple cold that you and I would shake in just a day or two, could be deadly to him. So we knew that I would have to quit my job here at the library and stay home. So what I want to make clear is it wasn't a case that I didn't want to work. I wanted to work. I love being a partner with my husband and helping provide for our family. We were just in a position that I could not work. And we wanted Jackson to have the best quality of life possible, and this is what we needed to do during that time. So after a couple of months with a special needs child, we found that, that it was necessary for me to cash in my optional retirement savings plan. We found it was harder and harder to pay those co-pays that we had. We had 11 specialists at Children's Hospital, and we saw at least one a week, sometimes 2 or 3 a week. So, each visit that we had at Children's was a specialist copay. It took gas to get there, and then there was most always some kind of follow-up prescription that we had to buy when we came home. Jackson's formula was over $60 a can, and we went through several cans a week for him. And so, you know, he could not walk, he could not talk, he was in diapers his entire life, so that was another expense. A lot of parents celebrate when their kids grow out of diapers, and ours never did. We had to have daily supplies. He had to have the suction machine on a regular basis throughout the day. He had to have daily nebulizer treatments, so we had to have the medications, the supplies, all that went along with those units that we had to have. He had to have a lot of over-the-counter supplements. He had bones that almost looked like rickets disease, so we had to have lots of over-the-counter supplements to keep him from just not being in pain with his bone issue. And as he started getting older, his body started growing in some different ways, and we had to get some special positioning for him, just so that he could be comfortable when he would sit in his chair. And that special wheelchair that we had to get cost $4,000. So we had to have special car seats, we had to have a special bath seat, we had to have a stander, which was several $1,000s. We had to have leg braces, we had to have arm splints to keep his limbs from growing backwards and being very uncomfortable for him. And so the thing that I want you to remember is he wore a 12 to 18 month clothes his entire 5 years that we had him. So all these things that he had to be specially made. So you can imagine the expense for making things for a tiny toddler in that size. And we had really good Blue Cross Blue Shield insurance, but even the best insurance that you have, it doesn't cover all the needs when you have a medically fragile patient, which our hospital friends in the room well know. And so we also had our other son who still had all those usual, you know, go to the doctor, have a cold, you know, medications, all those things that he had to have as well. And I want you to understand that Greg and I had our own personal feelings about receiving help. And we were both proud, but we realized not too far into it that the situation was bigger than anything that we could have ever planned for. And we realized that it was time for us to seek help from the system that we've both been paying into since we were 15 years old. He worked since he was 14, I worked since I was 15. We went and we tried to get Social Security disability, and they laughed us out of the office and they told us our child wasn't disabled. So I went back and I tried 2 more times, and after the third time I took him into the office and I sat him down in front of the woman's desk, and she told me, she said, "I'm sorry, he's just not disabled. You know, we can't give you SSI disability." So when I got home, I cried all the way home, and Greg said, "You know what, don't ever go back." He said, "We're not ever gonna do this again. We'll make it, we'll figure it out." And one day at church, somebody mentioned to me the elderly and disabled waiver through Medicaid, and I'd never heard of that before. And they said it's a different kind of list that you can get on. You know, you won't have to go through the office. Just get on the list and see if he qualifies for that. They only take a certain amount of slots for the waiver. And we were surprised. About a year later, we were on the list for about a year. Jackson's name came up, and he was approved. And they based it on his medical condition and how severe his medical condition was. So for the last 2.5 years of Jackson's life, the financial burden that we had was eased because of the help that we received from Medicaid. I never thought there was going to be a day that I would stand up here and tell you that I'm a Medicaid mother, because I've always said I would never have to do that. But what I have found is we can always say I'm not ever going to do that, but you don't know what you're going to have to do until it strikes your family. And this is what we needed to do to take care of our family. And I will tell you that there is such a stigma attached with Medicaid. And I remember there was one doctor's office that we had to go in and sign in, and they had a separate sign-in sheet for people that were on Medicaid and a separate sign-in sheet for people that had insurance. Well, I had my Blue Cross Blue Shield card, but because I had Medicaid, I still had to sign in on the other tablet. And I was always so embarrassed that I would put my Blue Cross Blue Shield card on top of my Medicaid card and slide it over to the receptionist so nobody would see it. And I remember one day I slid the sign-in sheet over and tried to sign it in like I was at the Blue Cross window, the insurance window, and the lady said, "Man, you had to put the Medicaid list back over at the other window." So, you know, there is such a stigma attached. And I will tell you this is a separate piece that's not associated with what Mr. Sisk is talking about, but we had to take WIC at one time. And I remember I would go to Walmart late at night because I didn't want anybody to see me in there shopping with that voucher. And it breaks my heart now on this side of it, looking at that, to think that there were people like us, you know, they're trying, they're working, they just have come upon a situation that they just can't manage. And there's just no point in anybody being ashamed when they have to do what they have to do to take care of their family. But being able to go into the system when we needed, you know, the help the most, It helped us preserve our family, it helped us preserve our home, it helped preserve our finances, it helped preserve our retirement. And so on February the 17th, 2013, when Jackson passed away at Children's Hospital, when we walked out of that hospital, we didn't need Medicaid anymore. And we came out of that system that we'd been in for 2.5 years when we no longer needed that. I took 6 months off of work, and then I returned back to work, paying into the system that had supported us in our most difficult time, and I'm happy to do that for others. I don't know how you feel about this. Everybody's entitled to their own opinions, but I know where my heart was at one time when I would hear some of these terms, and you know what? I know where it's at now, because I don't have the luxury anymore of being able to say, it's not ever going to happen to my family. I won't ever need that. I'm not ever going to go that route, because it has happened to my family. So I'm thankful that y'all let me just share my story today. Thank you, Mr. Sisk, for letting me share the story. Again, we've all got our ideas and our opinions, but I hope that just hearing this kind of gives you a different lens that you can take a look at this issue through. Thank you so much.
Tracey, thank you for sharing an incredible story. What Tracey didn't tell you today is based on the life that Jackson lived and the impact that he had not only on their family but on others. Every year today, by the way, there are not many diagnoses made annually that Jackson and Tracey and Greg heard on that day. Every year, across the country and across the world, families are coming to Alabama based on the leadership of this family to learn more about that, and they're bringing physicians, a group of physicians from the Northeast, the only ones in the world who really understand this fatal disease, and they're meeting with these families, evaluating these young folks, and hopefully one day we'll see some great results coming from that. So Tracey, we appreciate your leadership and all you're doing in that regard. And by the way, being a sportsman, let me mention this. I'm a UAB undergraduate. I don't yell "Go Blazers" much, but they're going to play football on October the 20th, and the quarterback for UAB will be wearing this name on the back of his jersey. Every year, the UAB Blazers honor the Children's Hospital. UAB will be honoring Jackson Thomas that day, so we look forward to seeing that. Who is Medicaid additionally? Medicaid is millions of nursing home residents across the country. Today in the United States, about 1.3 million residents of nursing homes are Medicaid recipients. Today in Silicaca, the 2 nursing homes that we have here, you'll see Medicaid recipients by and large, and about 23,000 statewide. And Dr. Shirley Spears has agreed to come and talk a little bit about the impact that Medicaid had on her family and the nursing home decisions they made as well. Dr. Shirley, thank you for being with us.
Wow, what a great story Tracey has, and how we all remember what she went through with, and we always appreciate hearing Tracey talk about that. She and Greg left no stone unturned. They looked at every option and tried every way in the world to take care of Jackson, to see that he was comfortable and happy, and to keep him as long on this earth with them as they possibly could. I have nothing but admiration for Tracey and Greg and their entire family. And I think Tracey is so generous to share herself in the way that she has. I today would like to say a special thank you to Vanessa and to Glenn and to all the Coosa Medical family for Community Links. I think it's such a wonderful thing for them to bring health information via the public library, and for so many years, I can't even remember, Vanessa, how long, but it's been a long time that they've been coming in and seeing that you have a good snack and good information, so I can't say how much I appreciate it. When Vanessa asked me today to look at the other end of the spectrum, knowing that we looked at a disabled child, a very young child who only lived to be 5.5 years old, she asked me to share my story about what Medicaid means to me, and so I wanted to talk a little bit about the old age dilemma. You know, I'm the person to do that, so I think that's a good thing to do. I'm talking about a time in life when it's time, to most of you, for you to take care of your parents. How many of you have already done that? You've been there, you've done that, you know what that's like. And now, with most of us, we're beginning to think about and face the time where somebody will be taking care of us. So looking at that, I think it's time for us to think about Medicaid, to think about what it means to people who find themselves at that juncture in life. So I wanted to tell a little bit about what happened to us and about my family. When it came time for your parents to no longer live independently, I want to ask you this. Did it come at a time when you were well established, you had a lot of money on hand, a lot of cash, and you were well able to do it? Or did it come at a time when you had kids in college, or you had kids in high school, or you had a big old mortgage you were still paying on, or your own health might be beginning to give you some problems? You know, you got a little racing heart like me, or something's going on with you. About 30 years ago, I want to look back just a little bit. So many of you will remember these people that I'm talking about. I used to go to lunch when I first came here, what we call the lunch brunch. That was Grace Nevians, who lived here in town, and she ran a music store, and Grace was a gifted musician. You remember her. That was Beth Yates. She was retired recreation director who, oh gosh, you know, Beth was just everybody's ideal. Maxie Beasy, her sidekick, who was retired, and Mrs. Carolyn Goff, who had been the librarian here for 19 years. And they just graciously allowed a little young me, about, 40-something. I thought they were real old men now. I wish I was their age now. But they were all over 65, and they were on their way to 70. And they talked a lot about the prospect of getting old. Don't we start doing that? You start thinking about getting old and about being a burden to somebody, and you wish that you didn't have to be a burden to somebody, and you want to remain independent. So I know that sounds familiar to all of you. Grace Nevian said one day when we were having our lunch, she said, "What I worry about is my very old age. What if I live a really long time? What if I outlive my savings?" How many of you know people who've outlived their retirement? Who've outlived their savings? It happens. It's easy to happen. I really never forgot what Grace said, but it was years before I knew what she meant, what she really meant. Grace lived to be 100 years old, and she was in care for a lot of those years. So over the years, I kept thinking about what Grace had said, and I thought, I hope she doesn't outlive her savings. I hope Grace has enough money to get her through. My dad was a farmer, if I go back and look a little bit, to talk to you a minute about my parents. The first 9 years of my life were spent in a place called Blue Springs. Anybody know where Blue Springs is down the road? And that was a sharecropping community, and my dad sharecropped for Colonel Lindsay McKinnon. We lived in a ramshackle house that wasn't sealed. We didn't have any electricity. And the McKinnons drove in from New York or someplace way off where they lived in a big old black car about once or twice a year. And they came to collect a fourth of the money from the bales of cotton that my daddy raised. They also came and to get a smoked ham, or they'd drive off with some of my mother's canned goods in the car. And they were nice folks. I'm just telling you what life was like at that time. They left behind a $1 bill apiece for all 4 of us children. We had a present from them. Now, for the second part of my life at home with my parents, we lived in Marble Valley, and the Purcells have made Marble Valley famous, so you know where that is. My dad farmed for himself by then. He had a little farm that had 40 acres, and he had 2 mules. You've heard that story about 40 acres and a mule. My dad was well off. He had 2 mules. There was no landlord then, but the pay was not a whole lot better. Do I need to tell you that my mom and daddy didn't have a 401k? They didn't have a fixed annuity, and they didn't have an IRA for their retirement. They did have a policy man, and they had a burial insurance policy. Most everybody had those. Now, even in older age, my parents lived independently on that little farm down there. They raised a garden. And they came down here behind Southern States Bank at certain times of the year, and to that shade tree den, and they sold green beans and watermelons and the different things that they had, cucumbers or whatever they had to sell. Some of you in this room have probably bought green beans from my mother and daddy when they were down there. They lived by my dad's creed, which was no man anything. He didn't believe in owing anybody anything. It didn't matter how little money they had, they didn't owe anybody anything. That was his way of living. Their task was a little easier about that time because they had their old age pension checks. Now you can imagine how much they were living on the farm and having farm income, but it did replace that back-breaking chore of raising cotton, which they weren't able to do anymore anyway. By 1998, my dad was 85 years old, and he was suffering from congestive heart failure, and my mama's memory was gone. They came to town to live in my sister Pat's backyard apartment. I always thought that Daddy finally agreed to come to town because Mama forgot how to make cat head biscuits and gravy. And he could have somebody else to help him keep an eye on her, but he could still have a small garden. In early April of that year that they moved to town, the weather was still chilly. My dad went out to the garden and took the 5-gallon cans off the tomato plants. He walked back in and he sat down in his rocking chair and he died of a heart attack. Now my mother, now it was her. She had her long little old age pension check, and she was in the care of 4 adult children who adored her. All had families, all had responsibilities of their own, and they didn't have a clue in the world how to help this old woman navigate the strange world of dementia. We just didn't know. The rest of the story is not uncommon. Mama was based at my sister Pat's house. We passed her around on weekends to help try to alleviate that problem of taking care of her. Now, we all know that we could have been more wrong with that. The one thing in the world that's important with dementia is routine, it's familiarity, it's being in the same place all the time. I don't know how much longer we would have dragged out taking our mother through that world of amateur care if she had fallen and she broke her leg and she broke her arm. And she made it necessary for us to seek professional help in taking care of her. This is my wonderful Medicaid story, which brings me great joy to look back on it. No, there are people in the world who pay taxes so something like this can happen. With help from Medicaid, my mother spent 5.5 years at the Silicaca Healthcare Facility. She thought she lived in an apartment and she thought the hallway was a street. She watched for red cars that went down Fort Williams with great glee. She'd say, "Ain't there lots of red cars?" And so she spent relatively happy years in a room next door to former Mayor Joe Dark, who was entertaining to say the least. I can't stress how close to many of us are to the same fate that I just described. Maybe not in that extreme of poverty as my parents had, but it's kind of all the same thing. Because unless you're enormously wealthy, you're not well enough off to have a catastrophic illness. You might think you are, but the best laid plans that you've got will go awry if that happens to you. The savings are soon gone when you spend $70,000 to $80,000 a year. Ted and I checked a few weeks ago on something else we were working on about the cost. And if you get a semi-private room, it's about $70,000. If you get a private room, it's about $80,000 a year for nursing home care. Medicare covers only a small portion of any kind of professional care, and they have no long-term coverage that I know of available through Medicare. So the question today that I leave with you to think about, regardless of what your opinion is of all of these federal programs that we all love to cuss and talk about and fuss about, but the question is this: are we going to say yes to Medicaid expansion to help take care of our elderly and our disabled? Like Tracey just described somebody disabled, there's lots of people in the adult arena disabled. Are we going to say yes to Medicaid expansion to help save our rural hospitals? So many people get to a hospital that's 50 miles away. Even those who get there may not be there in time. If you have a heart attack or a stroke, or you're in a wreck, or you have an accident, not having a local hospital might cost you your life or the life of a loved one. I had a first cousin tell me one time, we were talking about hospitals and how people love to have bad stories about this and bad stories about that, and he said, "You know what? My brother got shot in the woods. If it hadn't been for the Coosa Valley Medical Center, he would be dead. My dad had a bleeding ulcer and he almost bled out. A nurse at the Coosa Valley Medical Center saved his life." So there are numerous wonderful stories out there about having a local hospital and somewhere you can put your relative in the car and you can get there quickly. Would you have dreamed that Jacksonville, Alabama's hospital would have closed? I wouldn't have dreamed that they would give their hospital up. Would you have dreamed that we would have hospitals closing all over the United States? That people absolutely will not be able to get to care that they need in the manner that we do here where I live 2 blocks from the Coosa Valley Medical Center? Are we going to continue to reject a plan that might be critical to everybody in this room as you try to take care of your parents, or I'm looking at all of you like me, or yourself? So it may happen sooner than any of us can imagine. So I ask you to think about this issue. You know the commercial, what's in your wallet? Think about what's in your wallet and how long it's going to last when you face old age. How long will it be before you need Medicare? And will it be there for you and your loved ones? It's a question that I would like for you to ponder, and that's the message I'd like to leave with you. I appreciate so much the opportunity to talk about my wonderful parents. They were such great folks, good folks, hard-working, but they didn't have the money to take care of their old age, and I'm so grateful that someone was there for us. And thank you so much for listening to my story.
Well, Shirley and Ms. Tracey, thank you for your beautiful stories. Great to have you with us today. I know we've been going a little bit. We're going to hustle through this with a couple of final slides. How's Medicaid funded? Essentially a third of state dollars and 2/3 federal dollars. You see here that hospitals, nursing homes, and pharmacies impose taxes on themselves to raise dollars to get those federal dollars available in the state. You often hear about the cost of Medicaid. The challenge that we have with Medicaid cost growth is not the cost growth itself, but the fact that our general fund is not growing. You see here that Alabama Medicaid budget has grown at a slower rate than the national rate of medical inflation. How have we dealt with that? You'll remember the tragedy on the coast a few years ago. The BP oil spill money that became available to us, and our legislative leadership was very, very helpful through the years. It's no longer available, so we have to find another solution, and I submit to you today that Medicaid expansion is one of those. Why do we need to expand Medicaid? Conservatively, 300,000 people, could be up to 400,000 people in the state of Alabama would be eligible for Medicaid were it to be expanded. Today we have many hard-working people who wake up every morning, go to work, who make too much money to become eligible for Medicaid, but don't earn enough money to purchase the premiums necessary to buy Blue Cross and Blue Shield insurance, primarily here in the state of Alabama. Since 2013, take a stab at the percentage increase in premiums for commercial insurance in the state of Alabama. 5 years. What's that? 500. About 300 is what I understand, but you're exactly right. Think about the staggering impact of a near 300% impact on premiums. And then you overlay that with the cost of copays and deductibles, which in some cases are $6,000 or $7,000, and many people simply can't afford it. So there are some benefits economically of Medicaid expansion. The one thing that I will show you on this slide that I think is most concerning, since 2014, Alabama has declined $1.2 billion annually in federal funds that were designated for the state of Alabama. When the Affordable Care Act, Obamacare as many people refer to it, came to be in 2013-2014, the federal government said we're going to designate these dollars for the state of Alabama, for the state of New Mexico, for the state of Arizona. Conservatively for us, that's $1.2 billion. So since 2014, we've turned our back to $6 billion that would have helped pay for health care in the state of Alabama. Is it really working? Let's look at some case studies. You see in the state of Montana, 5,000 new jobs have been created since expansion. $280 million in new personal income. In the state of Kentucky, 12,000 new jobs have been created. Uncompensated care, remember CVMC, $18.8 billion last year. Uncompensated care declined since Medicaid expansion by 55%, and it had a $300 million positive impact on the state general fund. In the state of Arkansas, 19 hospitals in 2014 were at risk for closure. None of those hospitals have closed since expansion. In Louisiana, 19,000 jobs were created and personal income went up. In states where Medicaid has expanded, hospitals are 84% less likely to close than non-expansion states. And you see here, expansion states, on balance, have had a 47% decrease in the aggregate on uncompensated care. So who are the people who would qualify for Medicaid? By the way, there's quite a momentum going on in Silicotta. I recognize the local leadership. When you drive around town, you see a lot of things happening, see a lot of construction taking place. In many cases, construction workers who wake up every day, about 23,000 in this state, can't afford insurance, but would qualify for Medicaid expansion. If you're going to cook tonight, I might be available, by the way. I see a bunch of good cooks in the audience today. I might be available. However, if you're going to get a takeout and go to an area restaurant, about 25,000 people across the state can't purchase insurance based on their income and taking care of their family. So these are the people who Medicaid expansion, like many others, would and could benefit. So how do we pay for it? And we'll end here. This is the argument in the state that you hear all too often. To get that $1.2 billion, we've got to create a way, a means to pay for that. Today in Alabama, that will cost the state about $100 million. Now let's think about that comparison. If you had the opportunity to create $100 million to gain $1.2 billion a year, does that math work pretty well? I would say that it does. Here's number one. Shift the current Alabama state costs for mental health care and substance abuse patients to 90% federal responsibility through expansion. You see in the state of Michigan, they saved $190 million on mental health care when they expanded Medicaid. The state of Kentucky saved $30 million in the first 18 months of expansion as it related to care for the mental health needs in their states. Number two, shift the current Alabama state costs for inmate care to 90% federal responsibility through expansion. As Representative Johnson can tell us today, one of the things that the leadership in the state, and for those of you who are in Montgomery often understand, one of the most challenging budget items our state faces today is the Department of Corrections. Healthcare is a big portion of that. Let's shift 90% of the responsibility for that care to the federal government. Take that burden today, 100% of that burden, off the state of Alabama through Medicaid expansion. Number three, shift a greater portion of maternity care to 90% federal responsibility through expansion. One of the things that's happening in our state today, and the leadership of our Women and Children's Division team is here today, will be able to tell you. All too often, expectant moms in the state of Alabama do not get access to prenatal care. What's the downstream risk of that? Alabama has the highest infant mortality rate in the nation, 9.1 infant deaths per 1,000 live births, in large part because we're not getting access to prenatal care. Alabama's low birth weight is the third highest in the country. So not only financially does this help pay for Medicaid expansion, there's a public health issue that Medicaid expansion aids in expectant moms and new babies. What's the risk of not expanding Medicaid? We talked through that. Puts 90,000 healthcare jobs at risk. Doctors, nurses, pharmacists, and other key providers leave Alabama for opportunities that are better in states that have expanded Medicaid. So what can you do? Here's what I would ask you to do. We're not going to talk politics today. If you ask me a question about politics, I'm going to act like I didn't hear it. Is that okay? I'm not going to ask you who you need to vote for. You're not going to tell me probably. So we'll stay away from all that. But what I would ask you to do is this. Let's work together to find a solution that will help us somehow expand Medicaid in the state of Alabama. I want to encourage you, when you go to church on Sunday morning, when you're sitting at home tonight and your kids are on their phone, let's talk about what can we do to help impact the state of Alabama, and Medicaid expansion is one of the most positive things possible. We need to stay engaged in this and remain open to ideas about the impact that Medicaid expansion has on the healthcare infrastructure statewide, and more specifically, the positive benefits that it has here in Silicotta and CVMC.